Welcome to GovCast. We are joined today by Health and Human Services Director Liz Aldred. Liz, thanks for being here. In a previous GovCast episode, you highlighted the many departments or divisions that we have in HHS, as we call it for short, and the many things we're doing to connect with the community and help them better their lives. But the fentanyl initiatives, the awareness and the outreach that we've done has been a big effort of ours for several years.
Yeah, and it started, a couple of years ago when the county executive declared a community health crisis in Waukesha County. He did that for a couple of reasons, but the main reason was really to just raise awareness of the significant issues that people in Waukesha County were having with overdosing after the use of opioids and fentanyl, and really trying to get the public engaged and getting parents engaged in what is going on with their kids and what is going on with people in the community. And that has been successful. We partnered with the DEA, the Federal Drug Enforcement Agency, and state partners as well to have kind of adopt their One Pill Can Kill initiative, talking about how serious of a problem this really is. And it only takes one instance potentially to cause serious harm or death. And our efforts are paying off. So maybe you can talk to us a little bit about some of the things that your department's been doing in connection to that declaration and this issue.
Well, thank you for having me back. Thanks for giving me some time to talk about this really important issue. We have, as a department, but as a county, really worked together to address fentanyl and opioids in our community. I think to your point, really our key strategy was communication, was really working to let people know, raise the awareness, make sure people understood that the fentanyl issue in our community is not them. It's really us. It's us as a community. It could be your neighbor. It could be your child. It could be anyone you know, the person at church. It could be anyone you know. And we were seeing it throughout our county, and we were watching the numbers go up, the number of people who were dying by overdose, largely many, but not solely, people who, maybe didn't know they were taking fentanyl. So really trying to get that word out there. And as a community, we rallied together. So we have our other municipalities throughout the county really joined in. We did a strong marketing campaign. I'm sure almost everyone in the county got an email, a text, some kinds of things on their YouTube channels, really talking about the risks related to fentanyl. We actually, as a county, did a fentanyl series and looked at opioids in our community. We were able to bring in parents. We were able to bring in law enforcement. We were able to bring in people in recovery to talk about their journey. And those videos, that video series that we did, was so impactful. If people haven't had a chance to see them, they are on our website. They actually were able to receive awards for the impact that they had, because it did. It made people realize that this could be someone you know. So really, we spent a lot of time on education, awareness, and really that being some of the cornerstones. But that's not all. There are a number of other initiatives that we've done throughout the county. Again, partnering with our law enforcement and our fire departments. We have leave behind kits now. So if fire department, emergency rescue respond to someone who's had an overdose, we make sure that we leave information with the family members. We leave naloxone. Naloxone is, a word a couple of years ago, no one knew what that was. And now people are driving around with it in their car just in case somebody on the street is, somebody they could rescue with a nasal spray. We worked with our comms department to make sure that we rolled out Pulse Point in our community. And that's an app that you can download. First responders download it, so that if something is happening, you can be alerted that you might be able to go respond, and it'll tell you where to find naloxone. So that while we're waiting for first responders to be able to arrive on scene, emergency response can be provided with an AED machine, Again, having naloxone available and really making resources available to the average person so that people can save a life. We did a large, one of the largest, if not the largest, training in the state. We actually partnered with the Doc Hounds to be able to do a training at the state where they put it up on the big jumbo screen. And, we had people come over to our table and like, my friend, I might have known somebody, and really people were able to talk about it and get more information, get resources, and again, have access to naloxone, to have access to testing strips, the fentanyl testing strips. You're not sure if this substance has something in it. You want to be able to know. You ordered something online through a pharmacy online. We've all heard the stories where those pharmacies turned out to not be as reputable as your local pharmacy. So really making sure we're creating that safety in our community. So again, those partnerships with our law enforcement, our hospital systems. We have some great partnerships with our hospital systems. We have a group of 60 partners who come together who look at how we can make changes in our community. And one of the first things that came out of that group was one of our local hospitals, Pro Healthcare, decided, we need to have in our emergency room, next to our emergency room, a way for people to access naloxone and testing strips and those life-saving measures. So people can come in there, people who are on their way, people who are with their family members, people who are coming in for something else could have access to life-saving services. So really, when we talk about the point was to create awareness, we went beyond creating awareness. We've done things that have helped people that are just your average citizens who really maybe didn't even know about this 3 years ago.
So one of the things that has made the public more aware of this issue is it became an issue in the last presidential campaign. I mean, we had presidential candidates in primaries and in the general election talking about fentanyl, opioid use, opioid abuse, those sorts of things. And, people also may have heard about this. There are several very large court cases going on where drug companies and drug providers are or have been sued and are settling and delivering millions and millions of dollars to the federal government, states, trickling down to individual counties and municipalities. Waukesha County was involved in that lawsuit as well, along with every other county in the state of Wisconsin and the state. And we will be receiving significant resources as a result of that lawsuit for many, many years to come, upwards of 20 years. So what's your plan for some of those dollars? How can we use them? How can we benefit? How can people, boots on the ground people, really benefit from that sort of influx of cash?
So we've started to receive some of those funds. One of the things is that we allocate that money through our budgeting process. We have recommendations that go into our county exec, who go then through our county board to make the decisions about what we'll fund, so that we're doing things that are sustainable, things that start projects and are able to be continued on, because we do want that funds to be able to help us now and into the future. So we've really taken a very cautious approach to making sure that we provide the right resources. We've done a number of things because we've talked about treatment courts. Treatment courts is one of the strongest evidence-based programs you're going to see out there. We have some great treatment courts in Waukesha County. We have an OWI treatment court, and we also have one that's related to drugs and opioids, fentanyl, all included in that. That partnership with our judicial system, really, again, looking at that evidence-based and being able to provide people that oversight by the courts while they're getting treatment. And the outcomes of that program are phenomenal. So we've used that money to support that program. We've also used that money to support treatment for youth who the traditional outpatient is not enough, and to be able to provide a residential type of treatment so that they can reintegrate back into their schools and overcome that course of addiction and continue on, maybe again, eventually out into an outpatient kind of treatment. Really wanting to make sure that people have access to the right medications for people who are addicted to substances, again, so that people are able to go to treatment, not end up committing crimes in order to be able to seek drugs. We have a number of people who have entered into our judicial system and through our jails, and again, being able to provide some services in the jail system so that people can detox from the medication from the drugs that they were on, be able to leave the jail when their time there is done, and be able to not go back to using drugs, to actively using drugs. So really, again, connecting with the jail system, with our sheriffs, with our DA's office to really make sure that we're talking about the victims of crimes related to drugs and alcohol, and how we can support those victims to get the services that they need so that they are able to, again, get what they need following an incident related to drugs.
Can you talk for a quick second about our local partners? We like to focus as much on like Waukesha County here that we can. We have great organizations like the Love Logan Foundation that, started out of tragedy and has been able to raise money and raise awareness for this issue. The county exec's a big supporter of that group. Can you just talk a little bit about some of those local partnerships that we formed?
We actually have a number of partnerships. As a county, we do a lot of prevention work. We have a number of resources that we use throughout the county that are prevention providers who really do that messaging piece. Our friends with Love Logan, and again, as you mentioned, really working with partners who have had personal experience with loss, with tragedy related to opioid use, related to fentanyl use, and really being able to bring those people who share a different perspective, who really bring it home what addiction does to a family, to a community, and really making sure that we're connecting in and supporting them. So there's a lot of different activities, and they're used generally for, just kind of that outreach and really kind of making sure that people understand what is going on. We have also, on the higher end, really working with community providers to provide residential services, again, those high intensive treatment needs so that people get the right service that they need at the time that they need it.
And when you talk about partners, I mean, those are also partners who have our Oak boxes, the overdose aid kits. You're probably, now that I'm saying it, I mean, when you go out to really anywhere in the community, a gas station, a church, your place of work, I mean, you're probably going to see these red and white boxes. We have them at the courthouse. There's like over 200 in the community at our parks. That's part of, and you talk about kind of that accessibility to naloxone, commonly known as Narcan, the brand name. Is part of all of that, I mean, getting Narcan in the hands of so many more people now than ever, part of it, and the fentanyl awareness videos, I mean, breaking down that stigma, right? That this can happen to anybody. It doesn't matter if you had an addiction problem or not. It really, that one pill, I mean, it's really the truth. I've heard it from these grieving mothers. It was one time. And so is that part of it? And then as we see the overdose deaths from our medical examiner's office decline from opioids, from fentanyl, I mean, does that tell you that what you're doing is working?
I do believe that what we are doing as a community is working. And I remember when we put those first Oak boxes out there, and people were like, why are these here? And then you would go back the next day and they would be empty because people were needing the resource that was there. And really being able to, I don't even know how to use this, and really the instructions are right there. And people then really destigmatizing having it. People were worried that having naloxone made you think that I'm using, and maybe the individual is, Or maybe they have a family member or a neighbor that they care about, and really getting it into the hands of the people that could help somebody. And people really took that step back and said, it could be my neighbor. It could be. And, I've had the opportunity to talk to people who have administered naloxone or Narcan. And, having sometimes even to give more than one nasal spray, use that more than just one dose, and seeing somebody come back from near death and really being able to connect that person. It's been life-changing, life-altering for the person providing it, as well as the person who was administered the dose. Really, again, just making it so much more accessible and everywhere in our community, whether it's in our parks or our buildings or in, as you said, in our convenience stores or wherever. We at Health and Human Services do have additional boxes that we are trying to get out into the community. So if we have community members who are interested in a box that they feel like they could put in a common area, we had a number of people who are like, well, we'll put it back here in the staff office. We want them out and about. We want them so that people can. So when something does happen, I can run to the bathroom and grab one. And really working with agencies, community vendors to be able to keep them stocked, to have them available for when something happens or if something happens.
Liz, thank you so much for speaking to us about this important topic. Again, follow and subscribe to GovCast, and we'll see you next time.